Hi everyone, we're on section 5.4 and it says understand how pulse rate relates to heart rate and identify some pulse points. So our pulse, I think everybody knows what a pulse is. You have certain places in your body that you can touch and you'll feel a blood vessel under there and you can feel your actual heart rate. You can feel the pumping of your heart, the beating of your heart. So the rate of your pulse is going to be equivalent to the rate of your heartbeat, the spacing of your cardiac cycles. What you're touching when you're touching a pulse is an artery. There's certain places in our bodies that arteries are a little bit closer to the surface. Now, when you think of, like if you look at the back of your hands, you might see, maybe not because you're younger probably, but you'll see some veins there. Or other parts of your body, you can see veins. The veins are more likely to be superficial on the surface than the arteries, because when you think about it, the arteries have higher blood pressure. So the things that are most likely to be cut are things on the surface. And you want to avoid cutting arteries because you have higher blood pressure. You're going to lose more blood if you cut an artery, or you'll lose more blood faster if you cut an artery versus a vein. So our veins tend to be more superficial, and the vessels that are deeper will be our arteries. Except in some spots of our bodies, we have where the arteries are a little bit closer to the surface. And so in those spots, we have a pulse. We can feel the beating of our heart. If you look at those veins, you can touch the veins. You don't feel a pulse. And again, that illustrates the difference between the high pressure in the arteries and the lower pressure in the veins. So when the heart's beating, the artery wall actually expands a little. So it's important that there's that little extra muscle. So a surge of blood in the artery causes the walls to stretch and then recoil to relax. There's a bunch of places in our bodies where you can measure a pulse. And in nursing or in healthcare, there's a lot of reasons why you would need to know these different pulses. And, one of the things is you want to know, if somebody has a broken leg or an injury, is the blood getting to their foot? And so you might feel one of these pulses in their foot to see if you can feel the pulse. Is the blood getting down there? But for most of the cases, we would measure our pulse in the radial artery, which is right, the artery that's in our arm on the side of our thumb. So you can measure that. Or the other common one is to do the carotid artery right in your neck. It's really easy to find those. Those are both pretty easy ones to find. I remember being a kid and thinking, oh yeah, I wonder what would happen if I stopped the blood there. And if you push your carotid artery down, I don't know, does every kid do this? You start getting kind of dizzy, and it kind of makes you stop doing that. So you don't want to do that because you're stopping the flow of the blood to your head. So the pulse is a measurement of the heart rate. We have an average of about 60 to 80 beats per minute. So that's pulse and pulse points. I want to talk just a little bit more about blood pressure. And again, we've all had our blood pressure taken. We hear about blood pressure and how important it is. We all know somebody who's on blood pressure medication because it's too high. But the blood pressure is the pressure the blood exerts against the blood vessel wall. We typically measure blood pressure in arteries because that's where it's going to be the highest. So the highest blood pressure is going to be in the aorta. So here's the heart. Remember, the aorta branches off the heart and down the torso. That's the artery closest to the pump. So your highest blood pressure is going to be in your aorta. And then that blood pressure progressively decreases as it moves through the body. So the farther in the arteries farther from the heart, you're going to have lower blood pressure. When you get into the arterioles and capillaries, you're going to progressively lower blood pressure. When you get to the venules, it will lower even more. And finally, the veins, the vena cava, is going to have very low blood pressure compared to all the other blood vessels. So the blood pressure is the lowest in the superior and inferior vena cava, which enters the right atrium. We did that, right? So as you get farther and farther away from the heart, the blood pressure is going to be lower. So when we take blood pressure, We take it in specific spots of the body, and we know what that blood pressure should be. You'll have a different blood pressure if you measure it in your arm versus your foot, depending on what part of the body you're at, because you're farther away from the heart. So when you're doing the blood pressure, here come those words again, systole and diastole. Let's see, diastole or diastolic pressure. D, we said dead. That's when the ventricles are relaxed. So that's going to be when the blood pressure is the lowest. Systole is when the chambers are contracting. So that's going to be when blood pressure is highest. So what we do is we compare the highest blood pressure to our lowest when the heart's contracting versus when it's relaxing. So when we report blood pressure, it's reported as the systolic pressure, the pressure when the heart's contracting, over the diastolic pressure, the pressure when the heart, specifically the ventricles, are relaxing. The tool that measures this is called a sphygmomanometer. And I have to give you that word because sometimes it shows up in Jeopardy. Or you never know, you might be in a trivia thing and have to come up with that word. But that's what it's called. Sphygmomanometer. And some people just call it the blood pressure cuff because that's easier to remember. So that's what we use to measure blood pressure. And it tells you how it works here and all, and it would take me a little bit to explain that. But if you take nursing, they will explain it in detail and you'll understand how all this works. But the concept is that the top number in the blood pressure is your blood pressure when your ventricles are contracting, and the bottom number is the pressure when the ventricles are relaxing. So if we look at what we should have, normal blood pressure should be below 120 on top and below 80 on the bottom. So you hear people saying, my blood pressure is 120 over 80. Oh, that's good. That's normal. If it's considered elevated, and this is from the American Heart Association, elevated is slightly over 120 and still below 180. Hypertension. Hypertension means high blood pressure. And you can see that there's different stages of high blood pressure. 130 over 85 is not going to be as bad as 140 over 90. Okay, so you do not have to memorize these numbers. Actually, memorize normal. Normal should be around 120 over 80. But higher blood pressure, and you can see that you can actually cause a crisis, can be a really bad thing. Remember that when we go back and we look at all of our blood vessels, that if we increase the pressure, where's that picture? There it is. We increase the pressure in our arteries, we're going to be increasing the pressure in all these blood vessels. And with somebody with extremely high blood pressure, you can rupture capillaries. The blood pressure can get too high and you rupture capillaries. I know of a man in his 20s who was showing signs of high blood pressure. He was dizzy sometimes. He just didn't feel well. He had blood in his urine because capillaries were breaking in his kidneys. He lost some of his vision because capillaries broke in his retinas, in his eyes. So high blood pressure can be very dangerous. You got to be careful not to ignore when things like dizziness or blood in your urine or things like that happen. So that's the video on that. And here's some check your progress. Explain what the pulse rate of a person indicates, compare and contrast. Oh, this one falls in a section before. And why are valves needed? These are kind of earlier ones. So there we go.